Do you, Stephen, do you think there is an opportunity now for reform? And if you were in office today, what would the most useful reform be?
Well, I think when we use the word reform, Michael, we should remember that actually the latest management reform of the National Health Service is 6 months old. It came into effect on the 1st of July 2022, when I think very belatedly, but nonetheless it has now happened, that we've established local management structures, integrated care systems in the jargon, that bring together social care, the different parts of the National Health Service, into a joined-up structure. That's something that should have been done many years ago, but has now been done and is, I think, an important element. It's absolutely not a silver bullet, but it is an important element in using the resources the taxpayer commits to the health and social care system. It's a single system more effectively than has been the case in the past.
On this programme quite recently, a consultant surgeon was telling me that in recent times, never does he succeed in beginning his operating list at 8:30 in the morning. He offered a case of champagne if those around him could make it happen. He found that he was operating on half as many people as he was at the beginning of his career 30 years ago. We've just heard from a panel where people were talking about the mismanagement of the middle management section of the National Health Service. And I'll be talking shortly to a professor who's going to tell us about the failings of the GP contract. Are there not reforms galore that need to be tackled in the National Health Service?
Well, of course, there's a danger, Michael, when people like you and I who've been politically engaged in this over a long period, that we talk about reform as though it's something that's never happened before. Absolutely, there are changes that are necessary. And I've just identified one that belatedly the political class has put in place and which does need to be followed through. But you can't solve the problem in an A&E department without addressing the problems in hospital, in people delayed discharges out of hospital, people who should never have been in hospital in the first place if the social care system had been working better. We also need to use the resources available through pharmacy and through other parts of the health service in order to ensure that we haven't got people waiting to see GPs who don't actually need to see the GP. And your example about the consultants not starting lists on time, absolutely right. I completely agree with that. And that's about making sure, again, that the different elements of the system work more effectively together. Planning too often it happens that it's a surprise that somebody emerges out of an operating list, and there are consequences to that in terms of recovery support, the need for a discharge place, the need for family support. It's about creating a single joined-up system that plans for the use of resources effectively. In other sectors, doctors don't always like to be reminded of this, but this is not unique to healthcare. It's what's called supply chain management in other sectors.